There has been an increase in incidence of instrumentation surgeries and revision surgeries. Similarly, minimally invasive spine surgery is on the increase. And along with that has been an increase in the number of complications that we see. For example, symptomatic adjacent segment degeneration in MIS has been documented in up to 12%. And there is a significant incidence of neural injuries as well. Since the surgeries in very deformed spine have been also increasing, the number of complications has also increased because of the change in the normal anatomy in such cases. Also, a concern is the increased radiation with minimally invasive spine surgeries. To help overcome these limitations, researchers have taken the benefit of advancements in technology. Hence, navigation came in first after the freehand technique. But with navigation also, there are sources of errors. And even though there are possible solutions, there are concerns about the use of navigation also and the precision per se. Robotics is a marriage of image guidance with effector arm technology, and researchers have resorted to this as an advancement in technology. And let's see how this works. And we will consider especially the points which we would normally use to check if this is a value add over the previous technology or not. When it comes to planning, in freehand, it's image-based. In navigation, it is enhanced image-based and can take planning to execution with reasonable accuracy and control. In robotics, it's artificial intelligence-based construct planning, and it can take place in true AP, lateral, and axial orientation, and can be taken to execution with robotic precision and control. When it comes to registration, it's not applicable in freehand. When it comes to navigation, it's feature-based registration. And registration errors can come especially if disk work is performed before intra-op imaging. While in robotics, registration is automatic point-by-point mapping based on grayscale characteristics of the image that the system understands. The spine anatomy is segmented and registered vertebra by vertebra automatically, and the change in disk height doesn't affect registration as registration is done level by level. When it comes to execution, in freehand, it's based on direct visualization, knowledge of the anatomy, and experience and tactile feeling. There's less control and variable outcomes. Whereas in navigation, it's based on virtual navigation, visualization, and there's a partial freehand technique. On the other hand, robotics, the execution is based on robotic guidance combined with navigation visualization. It is fully robotic arm guided, and it's highly predictable and superior and has superior outcomes. When it comes to published literature, there's ample evidence of the superiority of robotics over the other two technologies. For example, accuracy is definitely far superior, and that is also substantiated by meta-analysis. Similarly, the reduction in fluoroscopy is also well documented, also in the meta-analysis. When it comes to revision surgeries and complications, they are far less with robotics. That is also well documented. The operating time is definitely not more with robotics, and the overall outcome is far superior with robotics as compared to navigation or fluoroscopic techniques. When we look at literature from 2019 to 2021, that is the latest literature, there's ample evidence again on the superiority of robotics over fluoroscopic technique, navigation technique, and superiority of this in pediatric patients, which is most complicated, is well established, and that of navigated robotics over non-navigated robotics is also established, and the scan and plan workflow of major robotics has also been shown to ease out the process and smoothen it. when it comes to learning curve, there's ample evidence in literature, as is evident from these two publications, that we do not have a significant learning curve with robotics. Thus, the superiority of robotics is well established by literature. In our experience, we have had 52 cases and 405 robotic guided screws, 26 cases of deformities, and with no significant complications, and good feasibility and good outcomes, as would be evident from these cases of a post-tubercular L2-3 kyphosis managed by robotic fixation with good outcomes. As you can see here, failed tubercular spine surgery with kyphotic deformity and progressive neurological deterioration managed in stages using robotic technology. Post-tubercular healed cervicothoracic kyphosis more than 80 degrees with thoracic myelopathy, treated with good outcomes. Similarly, congenital kyphoscoliosis with bowel bladder involvement with good outcomes. Similarly, post-tubercular thoracolumbar kyphotic deformity in an elsewhere operated case, the revision surgery went well with good outcomes, and this more than 100-degree kyphoscoliosis also managed well with good outcomes. So the progress in robotics continues, and this is mainly due to artificial intelligence. Summarizing this progress since 2001, the current generation robotics, in addition to accurate drilling trajectory, can help in planning, simulating outcome, executing, and navigating instrumentation in real time. Though there are some possibilities which still need to be tapped, but the future has a lot of potential, including automatic planning, use of different imaging modalities, including MRI, construct execution, rod bending, and integrating with OR devices is expected in the near future. So the take-home message would be robotic-assisted spinal surgery, as per current evidence, is more accurate, more efficient, and safer for pedicle screw instrumentation and spine surgery compared to traditional fluoroscopic-assisted freehand or navigation approaches. Literature has also proven that there is no significant learning curve. Level 1 evidence is required to increase the statistical power of these conclusions and define its future applications, limitations, and areas of improvement. With the evolving technology, future generation of robots have immense potential to improve spine surgery for both patients and providers alike. What we witness today may be the building steps to the definition of routine spine surgery in the future. Thus, robotic technology is a useful tool and not a gimmick. However, for the best use of technology, the surgeon and the robot both need to understand each other interchangeably. If one has not started, let's do that now before it is too late. Thank you for your patience.